Hi, I'm Pat Morris, your host for the PM Talk Show. Our telecast is made possible by these fine underwriters, and we thank them very much.
North Shore Center for Wellness is a behavioral health care practice that offers a myriad of services to children and their families in the Tangipahoa Parish community and surrounding areas. Our mission is to promote the well-being of the individual and families by providing accessible, quality health care. North Shore features quarterly Let's Talk wellness training, community outreach, and education. You can find more on these and other trainings on Facebook. For your convenience, North Shore accepts Magellan Healthcare and is located at 904 West Coleman. North Shore Center for Wellness. It's our goal to enhance the quality of life for our clients.
Parish's Supportive Living offers assistance in your home with everyday living tasks. We offer to the community long-term care, personal care, a community choice waiver, and many other services through the state Medicaid waiver program. Plus, we offer competitive direct service worker salary. You can contact Parishes at 985-662-5347. Medicaid, private pay, and insurance are accepted. EEOC. Parish's Supportive Living is also licensed and insured. Find them on the web at parishessupportiveliving.com.
Welcome again to the PM Talk Show. This is Pat Marsh, your host, and we're out here again on beautiful Miller Lake, FPTV 17. We want to thank you for joining us today, and with all of the changes that are going on in the medical field and the healthcare field, we wanted to bring someone on who is knowledgeable of what's happening to let you know, and we're talking of none other than Mrs. Valinda Vining Trepanier. She's the CEO for Parish's Supported Living. How are you doing today?
I'm doing fine, Miss Pat, and I'm glad to be back. Always a pleasure to be with you.
Thank you, thank you. We were talking earlier about a lot of things that's going on in the medical field and what's happening in our state that's going to probably adversely affect a lot of people who depend on those services. So I'm going to turn the camera over to you and let the audience know what's going on.
Yes, as I mentioned before, thank you so much for having me again, Pat, and we try to keep everyone informed of what's going on throughout the state of Louisiana, because it's going to adversely affect you and a lot of other people, especially your elderly loved ones. I have been preaching for years to please get your family on the long-term waiver or elderly waiver list. It's like a registry that the state of Louisiana does, and if I'm not mistaken, they are working on year 2009.
Oh my goodness.
Yes, ma'am. The state is working on the year 2009, and we are here in 2015.
Wow.
So I try to encourage everyone to please put your family member, especially if you have a loved one that stays ill or was in the hospital and that's sick, that you do not want to go into a nursing facility, put them on the registry as soon as possible. Because if they're working on 2009 now, Pat, what do you think where they're going to be in 2020?
I know.
But what the problem is when they reach 2009 and they try to contact these individuals that were placed on a list in 2009, there are many factors there. Number one, the person is probably already deceased. Or number two, the person is a full-time resident in a nursing facility. And these days, we know how busy everyone can be with work, school, young families, people just going about their busy lives of every day. You have to do something with grandmother, grandfather, or uncle or auntie or whomever. And I try my best to encourage people. I have been flooded here lately with a lot of phone calls from other states that have loved ones here in Louisiana because they know how in somewhat unstable the care is here in Louisiana, that they're asking me to help their loved ones. And just all of a sudden, I've just been getting bombarded with a few phone calls from California asking, I have a grandmother that's there in Louisiana. I want them to get the best of care. Can you please take down this phone number, check on my grandmother, see if she qualifies, and so on and so forth. And when I call, I tell the family member all the information that they were going to need for that loved one, their name, their full name, their date of birth, their social, and what's most important is their current Louisiana address. being a Medicaid recipient is not important at that time, but the information that you do give them is pertinent that you have handy in your hand, because they don't have time to hold on and let you find it and gather it. So it's important that you have all this information in front of you when you call the state of Louisiana. And when you call them and they say, yes, they do qualify or they don't qualify, in most cases, they're going to not qualify. Because most people that receive this free service through the state of Louisiana have to receive full Medicaid. Some people do have the white Medicaid card with the Louisiana's emblem on it, but that does not mean you receive full Medicaid. And I tell people all the time, check on your loved ones' programs and see if they're eligible or qualified and what do they really have. Always try to see what card they are holding. I did not say Medicare, I said Medicaid, because most people call my facility and say, well, my aunt receives Medicare Part A and she receives People's Health and she receives Total Choice 65. None of those programs will qualify for you, will not qualify you, for long-term care. You have to have full-blown Medicaid. 9 times out of 10, the person does not. What do you do in that case? Don't give up. Apply for Medicaid. A lot of people don't realize all it takes is to go and pick up a Medicaid application or get it online. You can go to any state website, download it, fill it out. I don't think you can fill it out online, and put a postage stamp on it and mail it. You'll be surprised how many people call me back and say, guess what? She qualified for Medicaid. Just because they told you the individual did not qualify on the phone does not mean that they won't qualify by filling out the application and getting qualified.
Okay, what are the eligibility requirements for a senior to get full Medicaid?
See, that's a very good question, because it is so many rare instances, it's many factors. At one point, it was the income. Of course, you cannot receive full Medicaid if you own 20 acres, a cow, a mule, a 3,000 square foot home, and have a bank account to die for. No, you won't be eligible for Medicaid. Medicaid is strictly enforced and given to the indigent and the poor. It's for those individuals who did not have a very good education or worked hard all of their lives and never made, didn't pay into the system a whole heck of a lot because they weren't making a lot of money. So it depends on each person's individual circumstance and situation. Some people was receiving full Medicaid and was receiving $700 Social Security a month. Some people were not eligible for Medicaid and they were receiving $500 a month. So it's a lot of different factors in there, Pat. It just depends on what the person's Social Security comes back with, what they receive, what they're eligible for, how much they have in their checking account, savings account, if they own any land. It's just a whole lot of factors in there. Now, there are a lot of people, as I said, may not qualify when you first call and make that phone call. But once you fill out that application, then you'll see, it'll be surprising that you just may qualify. Then, once you do qualify, you move forward with putting that person on the registry or receiving the service for someone to come home. And the question is, some people ask me, okay, what is long-term care? That is the care in the definition of someone going actually into that individual's home and servicing that individual with daily living skills, whether it be combing their hair, toiletring them, helping them out of the tub, fixing a meal, mopping the floor, things that we take for granted because we're healthy and we're able to do it, that may structurally hurt another person who may not be able to do it.
So it's kind of helping them to live independently.
In their own home.
Right.
That is correct.
Okay.
But a lot of time though, Pat, a lot of people have family members that the individual actually live with. But those family members also have a life. Those family members work, go to school, or anything of that nature, so they can't be there 24/7 with their loved one to assure that they don't fall, they don't hurt themselves, because we all know most accidents happen in the home. Right. And elderlies are very subject to hurting themselves, because my mother-in-law stepped on the back of her slipper a few years ago and broke her hip. So these things do happen. You know, accidents happen in the home, especially in the tub, the kitchen. They can burn themselves, the tub, they could slip and fall. And as I mentioned, my mother-in-law was just walking down the hall and just stepped on her own slipper and fell and broke her hip.
Okay, I'm sure she's doing okay now, though.
Yeah.
Okay.
So with that taken, you know, we have to be more alert of what's going on in our loved one's home. And I'm completely against leaving someone home by themselves. Do not leave anyone unattended and home alone. That is the worst thing that you can do. I know that you have to go to work, and I know you got to get your kids off to school. I know you're juggling and taking care of 1,000 things at one time. Don't leave them home alone. That's the worst thing you can do, because then that's when accidents mainly happen. You know, you come home, I hate to say it, the house could be on fire, because most of us, I was listening to WWL this morning coming into work, and they were saying how most elderly are subject to being hurt nowadays because they think they can do it.
Yeah.
They think they could climb that ladder and clean those gutters. They, you know, they think they can get on that ladder and paint that shutter. They say the 70s is the new 50s, and the 80s is the new 60s, and people are taking better care of themselves now. But that don't mean that you can do everything you want to do.
Right, and I'm finding that out myself. Really, I am. So
you know, we got to just be conscious of what their limitations are. Because my dad would be 79, I want to say, 78 or 79, April 5th. And we all know what Mr. Vining looks like.
Yeah.
I mean, he takes excellent, care of himself. He bowls twice a week. He enjoys bike riding, skating, the whole 9 yards. But I know he has limitations.
Yeah.
Don't try and get up there, because right now he's ready to roll in Mardi Gras. Get off of that float and let them young boys go and nail that stuff up and clean that float off. Are you listening?
I'm sure he is, but I don't think it's going to do any good, because you know how we are.
Exactly. Let them young folks do all that heavy lifting and that working. You go sit down and relax.
They don't do it like we do it.
But enjoy your letter. Enjoy your life. But I know he's saying, I want to do it myself. Make sure it's done right. Okay.
And I can't blame Mr. Vining the same way. But we're getting ready to go for a break now. When we come back, we'll come to part 2, and we want to talk a little bit about Medicare nursing homes and what the limitations are there.
Wonderful.
We're going for a break now. We'll be right back.
Thank you.
Adopt a child from foster care. Just being there makes all the difference.
Welcome back to the PM Talk Show. This is Pat Marsh, your host, and we have with us our guest, Mrs. Belinda Vining Trepanier, and she's the CEO for Parish's Supportive Living. And before the break, we were talking about Medicaid and all of the different changes that have come and will be coming. Before we went on break, we were talking about those things and people who may need to put their loved ones in long-term care.
That's correct.
And there's a number on the screen that will let you know. It's an 800 number where they can call.
That is correct.
And get the information on whether or not they would qualify.
That is absolutely correct. What it is, Ms. Pat, is that it's called the registry number. You can actually even use that line to say that you want to put a loved one on the EDA waiver, or any waiver that's existing through the state of Louisiana. You can call that 1-800 number.
The EDA meaning?
That's the elderly disabled waiver adult. Now, changed EDA and turned it into CCW, it's a lot of acronyms.
Yeah.
The state likes acronyms because they want to shorten it. And what that means is the long-term care, but we do long-term care / EDA. We keep the EDA in it even though it's really not in existence, because a lot of people are used to hearing it. And with elderly people, you can't keep changing different things because they're not understanding it. So what we do is we advise all of our folks that may call my facility to call the 877 number. I'm sure it's flashing on the screen. And then you can see for yourself if your loved one qualifies for the long-term care. And again, if they do not qualify for long-term care, fill out a Medicaid application, and they just may apply for Medicaid that way. Because they don't qualify per, let's say, the telephone, because of the information that you're giving them over the phone, once you fill out the application, it's a good possibility that they may qualify.
How many hours? I'm sure they have different rules for overtime and what have you. Can you explain what's going on there?
Yes, the state of Louisiana is momentarily, they're experimenting with something that came down from the federal government. So actually it's the federal government that is pushing for the states to include Medicaid waiver providers or any type of medical worker inside of their 40-hour rule. Meaning that an individual, because right now we are not 100% in compliance or pushing compliance for that right now. I think that's going to come down July 1st when the new budget comes out, fiscal year. Then we will find out if it is in fact, because right now as it stands, it's supposedly the law, but they're just not enforcing it as of yet. But it's going to be really hard for agencies like mine, Ms. Pat, because you're telling us that an individual who works 40 or more hours per week, you have to pay that individual time and a half, meaning that you do have to pay that individual overtime. However, the reimbursement rate from the state of Louisiana does not justify overtime. So if a person is making just minimum wage of $7.25, and if you divide that by 2, even if it's $2 more, your reimbursement rate in some cases is only $8 an hour. You cannot pay for that individual's workers' comp, their insurance, their taxes, anything for that matter. So most provider agencies will probably have to go out of business from that one. I don't even use the word simple rule for that one real bad idea. Because what the people don't understand, and when I use the word people, what the federal government does not understand is these people don't want overtime. They don't want time and a half because of the simple fact they can work 60 or 70 hours per week, and no one wants that overtime. They are happy with the hours that they are receiving because they know that the provider agencies aren't making the reimbursement. Now, if we were being reimbursed $20, $25 an hour, we can do something with overtime. But it also filters down, Ms. Pat, down to the client. Most clients, no, I'm not going to say most, all clients are happy with the staff that they have. They do not want to put 3 and 4 additional workers in their home because they have to have one person that works there only 40 hours. So if you have someone that's working, let's say 52 hours a week, that means you have to have a full-time person, and then you have to get someone else to work the additional 12. However, who's going to work 12 hours a week?
Right. Nobody.
No one. It's not worth my gas in my car. So now you're thinking about splitting your 40-hour-a-week person to make it fair, and just say, okay, you work 24 hours and you work, you work the remaining hours and split it up. That is not fair. So what a lot of people, and when I say a lot of people, I mean a lot of my recipients, what they're asking me to do, well, I tell you what, Ms. Belinda, I don't want no more than 40 hours. No, don't give in. Don't give in. Don't give in. I always tell people, call your provider, get the 1-800 number to call to complain. to the state of Louisiana that you think this overtime rule is bad. It's bad for the state, it's bad for the economy. Everyone is happy the way it was. I mean, we have not been included in this law in many, 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 many years. Now all of a sudden, you want to include these people in this law. Some people even thought to maybe split provider agencies, like work with my agency 40 hours and work with another agency for those remaining 12 because they want to keep the same worker. It's illegal. Right. We called and we asked and they said it's called conclusions. You know, there's a word for everything. Right. Conclusion. Okay, what that means is that you cannot work for one provider and have a recipient that works with that one provider and get another provider to work the remaining hours to try and avoid paying overtime. Simple. You can't do it. So that's just one of the many things that's coming down the pipe to us, of course. And then I found out today there's a major, I can't say the name right now, but there's a major Medicaid provider also, but it's an insurance provider that's going out of business here in the state of Louisiana, that people are going to be scrambling around looking for coverage.
Okay, let me ask you this. When you talk about overtime, and it is a federal law that says anything over 40 hours, you have to pay the person time and a half.
Yes, ma'am.
Because medical providers such as yourself that do services for people in the homes, right?
Yes, sir. Yes, ma'am. I'm sorry.
How is the state receiving any federal funds to assist you? You know, a lot of things that the state of Louisiana under the current administration, they just didn't receive any federal assistance. Is this because this particular thing is happening, or is it designed to drive a lot of people out of business?
It's designed to drive a lot of people out of business. Let's be real. They have been trying to get rid of companies like this for many, many, many years. And this would be a sure way, a sure fact way of doing that. But I say don't do it. Don't give in to it, because these people, and it's not so much the agencies. There are a lot of good provider agencies out here. There are a lot of us that are out here that work hard, that work with the client, listen to the client, do things correct, do it legal, do it right. We've been in business since 2001. I've seen provider agencies come and I've seen provider agencies go. I've seen some get arrested and I've seen some get shut down, but they're all not bad.
Right.
You weed out those bad apples and then you concentrate on what you're supposed to be concentrating on, and that's to help these people that are desperately in need. You cannot just stop these services and close providers down. That would hurt all the citizens in this state if that was going to happen.
And then you have to wonder what would happen to these people. You know, if they can't get the services, or
Absolutely.
if they're accustomed to doing things in their home. And I fully understand that, because that's your comfort zone.
Exactly.
Your home is your comfort zone.
And you don't want strangers. Some people get used to or get attached to their direct service worker, which is a DSW. They don't want that person to just work those 40 hours and bring in another staff that they don't even know.
Right.
So that makes people uncomfortable in itself.
Right.
So what they're hoping is they'll contact their case management agencies and say, you know what, just give me the 40 hours then. Just stop I know I'm eligible for 67 hours a week, but stop it at 40 because I don't want anyone else to come in my home. And that is not, no. You get these hours because you have been assessed and you have been evaluated for those hours, and you deserve those hours. Do not give up your comfort zone. Don't give up your hours. Don't.
Okay. When we look at Medicare, they have various parts, Part A, Part B. Does Medicare still pay 80% of the services that's needed, or is it just strictly for hospitals?
It does pay the 80% that's needed. But a lot of people, what they don't understand and realize, you cannot do two at the same time.
Okay.
I have a lot of people that receive Medicare and Medicaid that's a recipient in my agency. But some people may go into the hospital and they don't understand why their worker cannot go into the hospital, because remember that nurse is working with, let's say, the whole entire floor. So I want my individual person to work with me. And it was a problem early on in the, I would say in the baby part hours of my agency when we used to deal with that. We used to get timesheets from people, and I knew that the client that they were working with was in the hospital. You cannot bill 2 medical agencies at one time. So in other words, the worker cannot work in the hospital because Medicare and Medicaid has to be paid first. Then your worker gets paid last. So your services actually stop the minute your handwriting sign or the minute you're admitted into that facility. Your services stop with a provider agency.
Okay. But let's say if a person goes through the hospital and they are treated for whatever and they come home, okay, the services pick up again.
Yes, it does.
My question is, if they have Medicare and Medicaid, would both of those make up the difference?
Absolutely. Okay. Yes, absolutely. They should not get a bill. And also, to reiterate, Ms. Pat, I wanted to mention as well that Parish's Supportive Living is one of the only agencies in Tangipahoa Parish that service veterans. Okay. Yes. Okay. So if you are a veteran and you need services in your home, we do have several veterans with us now. Just give us a call. We'll be more than happy to talk to your primary care doctor and get our license and other information. And we do, of course, accept most insurances. Okay. Private pay, whatever you have, and we do a sliding scale for private pay, so don't be nervous about that. A lot of people say, I really don't have much, but I need someone to come in and help me get out of bed and so on and so forth, and we work with those individuals well as well.
Okay, well, I can see in a couple of months or so I'd like to bring you back when we get more information.
Definitely after July. Definitely after July. I would love to come back and sit down with you and tell your audience, you know, exactly
where the state is now.
Where the state
where
is
they will
now.
Be at that time.
Absolutely.
Okay.
But it's been a pleasure, Ms. Patty, as always.
It has been, and we thank you for coming on. And
absolutely.
Until next time, we want to say this is Pat Morris, your host for the PM Talk Show. We thank you for continuing to join us, and we want you to know that we want to continue to bring knowledgeable programs to you because we're facing some hard times now, and people just need to know what's going on. So thank you for continuing to join the PM Talk Show. Always remember that knowledge is powerful and it does matter. Thank you for joining us again. God bless.